for being here today. Wayland Baptist, President Wayland Baptist is here with us today. We're joined by leadership from UMC, by the CEO, Mr. Funderburg, Chief Medical Officer. Thank you all. Mike, thanks for being here. Mark, thanks for being here. Craig Ryan, and part of the team, Karen Baggerly from the leadership at Covenant, Chief Medical Officer, Chief Nursing Officer from Covenant. Our superintendents, our 3 school superintendents here, Keith Bryant, Michelle McCord, and Kathy Rolo. Thank you guys for being here today. We've got some of our large employers here. Certainly nobody's larger than United Supermarkets. Robert and Sydney, we're glad that you're here. Thanks for being here. The Chamber's here in force. Gabe Vitella, Chairman of the Chamber, is here, along with some of the Chamber's staff. Our chiefs are here. We've got all our emergency management folks. I just wanted to thank you for showing up. I think it's important that our community see that together we're planning for this and we're prepared for whatever we might encounter. Okay? So with no further ado, I want to introduce Catherine Wells. Catherine's the Director of the Public Health for the City of Lubbock, and she will take it from here. Catherine.
Thank you, Mayor. This afternoon, we're going to be providing an update on our preparedness activities around coronavirus, and we're really going to be focusing on what we've done since our last press briefing, which was March 3rd or 2nd. We really continue to closely monitor the situation and are following our long-standing public health plans that have worked for us in the past as we've had to combat other disease outbreaks in our community. In addition to my update, you'll also hear from our local health authority, Dr. Ron Cook, and from our city manager, Jarrett Atkinson. And at the end of the briefing today, we will have time for questions and answers. And I really do appreciate this great turnout and the support from all of our community partners, because combating this virus in our community is going to take work from all of us. So last week, the State Health Department announced the first positive test results of COVID-19 or coronavirus. The first cases were travel related. However, today they are investigating their first case of what they expect is a community acquired case, and that is in Montgomery County, Texas. Because of that, we absolutely need to be vigilant to keep our community safe in this situation, and the situation's evolving quickly, so we need to be paying attention, really looking for cases, and really starting to plan in case we have a case in our community. I'm now going to pass this over to Dr. Ron Cook, our local health authority, to provide a medical update. Thank you, Dr. Cook.
Thank you, Catherine. Just to sort of, again, recap kind of where we came from, and some of you may not have heard this information before, but I think most of you have paid attention to the news and know that this virus came from China, right? And that it's a coronavirus. This coronavirus are very common. Lots of little kids, all of us have had coronaviruses before. What's unique about this one is that it is new to us. Most of the coronavirus live in animals, and somehow this one came to us. It started in China, now it's spread across the globe, really. So the unique thing about this one is our immune system hasn't seen this virus before, and that's why it's affecting us so severely. It seems to be a little more virulent, much more infectious than the flu virus, and that's why we're seeing it bloom so rapidly across the United States and the world. How is it transmitted? It's transmitted by contact and or respiratory droplet, primarily respiratory droplet. Everybody's seen the commercials, right, where somebody sneezes against a black backdrop in this huge cloud of droplets. You can't see those, and you walk through that, and then you're going to get it. And so what's the incubation time? How long do you have, right? It's anywhere from 2 to 14 days, roughly, and we think that most of this happens 4 to 5 days into it, where most people show up with this infection. It typically shows up with high fevers. That's the number one presenting sign. And about 83 to 85% of the cases have a high fever. And then all the other things that you get from a viral syndrome: cough, runny nose, sore throat, maybe some belly pain, maybe some diarrhea, but lots of muscle aches and headaches, those sorts of things. So it's a very typical presentation for a viral infection. So who's at greatest risk? And I think today I want to really focus on that population. That population are the more mature, more experienced, as I usually say in my clinic. Those of us that are 60 and beyond are the most vulnerable. Now, if you're 60 and beyond, and I am not far from that, but if you also have cardiac disease, that's the #1 comorbid condition, or if you have that disease, severe heart disease, that's not controlled well, or lung disease like emphysema or COPD or diabetes, those are all, or uncontrolled hypertension, that would be in the heart category. Those people do not as well. They just don't do as well if they get this infection. If you're 65 or 80 and you don't have any of those problems, you're probably going to do very well, except for your age. That's the one black mark against you. So we have to be careful with those individuals. There's one other group that we need to pay attention to, and that's our pregnant population. They seem to not do as well either. So that's who's at greatest good risk. What do we do to prevent this? You wash your hands. I said it last time 3 times. Wash your hands, wash your hands, wash your hands. Stay away from people that are sick. Keep your hands off your face. So you've all heard that, right? How many of you have been counting how many times you've touched your, oh, I shouldn't be doing that. We do it all the time. I sit at home and work on stuff, and I touch my face all day long. So you really got to be conscientious about that. And so what do you do if you're sick? You don't go to the doctor. What are those worrisome signs? Shortness of breath. You can't breathe very well. You're having chest pains. You're having chest wall pains. Those are all worrisome. High fevers that aren't controlled well with Tylenol or Motrin. You need to let us know. But call us, please. Call us. And then the other thing to do is, like I said, stay at home. We call that social distancing. If you're infected, we don't want you in the clinic. We don't want you at the hospitals. We don't want you at the mall. You should stay home. We call that social distancing. I have a couple of slides I want to show you. What do you mean? What do we do? So what does social distancing do to this infection? If we slow this infection, and we see here, so we'll call this line the flu, and this line the coronavirus. It comes on much faster, but this is where our healthcare system is saturated with our sick patients. It's not like the ICUs of all of our healthcare systems. They're just waiting to accept these patients. They already have patients in ICU. They already have patients in the isolation. We already have sick patients in step-down units. So we're not saturated yet, but we could easily be overwhelmed if we don't slow this infection rate down. This is the time since you got the case, and this is the number of cases, the time since the infection. And if we reach this point too fast, we can't handle it. But if we do social distancing, like keeping people away, keeping people out of the public, if you're infected, we can push this down where our healthcare system can handle the current load that's going to come in. Is this going to happen? It's going to come to Lubbock. It's going to come. And if we can keep sick patients at home that don't need to be out and about and running around, then we can push this. It's called flattening the curve. We can push this to the right, okay? And so social distancing means anything from canceling trips, I think they just closed the Houston Livestock Show, I just heard. So those are big gatherings. Stay out of those arenas or venues to help slow this virus so we don't spread it so fast. It may require the other extreme of that is closing schools, closing businesses, limiting travel. I know that the Health Sciences Center and the main undergraduate campus has already said till the end of April, you're not going anywhere on our dime because we don't want to facilitate the spread of this disease. So it may be stronger encouragement to do that, closing schools, that sort of thing. What happens here with this first slide, one of the things that happens is not only do we not have enough equipment to take care of these people, we don't have enough people to take care of these people. So if we can push it this way, we have enough efficiency in the system to take care of that. Let me give credit to Dr. Susie Wiles, and a physician in New Zealand, and Toby Morris, this illustrator. I got to give him credit for doing that. So what's best for you? is to wash your hands, stay as healthy as you can. There will be tough decisions that need to be made soon in this community. Not everybody's going to be happy about it, but we got to think best of what's best for the individual and our community as a whole. Those are going to be tough decisions, not made by me alone. I'll be at as many people as I can to help me make those kind of decisions. So that's all I have. Thank you. It'll be for just a few weeks, we hope, when we have to make those decisions. It's not going to be forever. You don't want to get somebody so sick that we have poor outcomes when we could have waited a month or 6 weeks and postponed whatever trip or whatever you've got planned. If we could wait 6 months, 6 weeks, and take care of it and everybody stay healthy. So, thank you.
Thank you, Dr. Cook. So as Dr. Cook's talking about, this is definitely an evolving situation, and the department continues to follow our protocols for disease investigations. This outbreak has raised our level of alert, but our core public health procedures to identify disease will really support the control of this disease in our community. We want to identify any cases early and be able to stop anybody or prevent them from infecting others. So the goals of the health department are really to inform our local healthcare providers so that they can identify those at greatest risk. We want to communicate to the public about risk and how to reduce that risk. Last week, the health department launched a new web page, ci.lubbock.tx.us/COVID-19, and this is a place to find accurate and up-to-date information. We have links on that website to all of the official government sources so people can get good accurate information. We will also be investigating all suspected cases of coronavirus. And a suspected case is an individual with fever, upper respiratory symptoms, and exposure, either through travel or a close contact. We will also be facilitating testing. We now have testing capabilities here in Lubbock, which is great. However, people must still exhibit signs and symptoms and have that test ordered by a doctor to get tested. And then our other goal is to react quickly in response to any positive case. And this will include contact tracing, so that's identifying those people who may have come in contact with the sick individual, isolating those individuals, and working on testing. And that's one way to really prevent the disease from spreading. The department is also here to support our hospitals and healthcare facilities as they implement various control measures. These measures are really meant to protect patients and manage their supplies, and include things like limiting the number of visitors in facilities, especially to those that are elderly or on isolation. And although these restrictions may be unpopular, we need to take the steps to limit potential spread. This will help protect our most vulnerable populations, such as our seniors and those with chronic medical conditions. So we're all going to have to sacrifice a little bit if we end up with this disease here and limit our movement. And, you know, people are in the hospital, contact them by FaceTime or, you know, phone, really to prevent other people, sick people getting into the hospital. And now I'm going to go pass it on to our city manager.
Well, I do wish to thank everybody again for being here today. We really appreciate the turnout. My part's a little more simple. You've heard from the healthcare experts already today. As it relates to the city's operations and the city's ability to support both our essential operations in the community, I want to remind everybody this is really kind of just 3 areas of focus. It is a public health issue. The plans for addressing these types of public health issues, they're long-standing. They're well-tested. The system that will help us respond to this is not new. The particular virus is, and as we've seen from the prior chart, I guess, we know we have to respond a little differently, but the manner in which we'll do so is well established. So that's number 1, and that's number 2. Number 3, what does the city do? What are our emergency plans? First, it is supporting your public health system. That is the number 1 thing we do. The city brings to the table quite a bit of capabilities, a large number of resources. Those focus first on assisting the public health authority and the public health director to do what they do best. And the second part of that on behalf of the city is just ensuring the continued delivery of essential services. And I want to assure you today, we have those plans. Those plans are also long-standing. They're all being game planned again as we go today, and we will continue to do that. I said all of that when we had this opportunity a week ago. I do have a couple of new pieces of information. First, we now also have, in addition to all of the various internet resources and the group calls and the WebExes, we are established with a direct connection now to the Department of Health and Human Services. So that's at the federal level. And what that really is designed to do to ensure if or when we do have this in the community and there are resources that we may have had and we run short, that we're on a direct line now to have those refilled. Those might be things like testing kits. So that does exist. That was established yesterday. Final point of new information. Hope everybody had a chance to see the media today. We just conducted a very large emergency management exercise, and this one was focused on our airport. So on its face, not necessarily related, but would contend that it is. So throughout that exercise today, we had over 300 first responders. They were all involved. Everything the city has to bring to such a situation, many of the county resources, healthcare industry resources, state and federal. They were all here. In fact, they were right across the parking lot. Of those agencies represented, more than 3/4 of them are tied together to help us support our continued operations, to support public health and public health authority. So, not only do we have those, that set of plans was well tested, and it was tested this morning. So, a lot of the faces in this room have been awake a long time today. We had many of them at the airport at 6 o'clock this morning. So, to those of y'all that I've seen twice, thank you. But to everybody else, just please know, we're actively engaged. Our partners are actively engaged. Our ability to work cooperatively together to bring resources to bear on a problem, those were tested as recently as this morning. With that, I'm going to go ahead and stop. We are going to take questions for a moment. So I'm going to ask Dr. Cook and Catherine to come back up. I'll attempt to moderate that and help y'all, but please, if you've got questions, this is your chance.
Will most of the testing be done at Texas Tech labs, or will it be other places as well?
Currently, all testing for our region and surrounding regions will be sent to the LRN laboratory at Tech.
And are those tests free to the public?
Yeah, when they're approved by the Public Health Department and sent there, there's no cost to the individual.
How long would that kind of approval take? What does that process look like?
The current process is if an individual goes to their doctor's office and they are showing the signs and symptoms of coronavirus, they would be calling the health department. The health department would get what they call a PUI number, and that's a number that allows the specimen to then be taken to the laboratory. And the wonderful thing is the laboratory is close, so we don't have to worry about that shipping distance that we have to do with some other specimens.
And Catherine, the laboratory turnaround on the test?
It's
24 hours.
It's 24 hours. Right, they're in here.
So do you want them to go to the doctor's office or to stay home?
We want them,
Well, if you're sick, stay home. Unless you exhibit these really high fevers, there are 4 criteria that you have to meet, right? High fevers and symptoms of coronavirus, exposure to a known coronavirus person. The second is high fevers, etc. Travel from one of those listed countries. The third one is new is if you have one of those conditions we talked about, you're really sick and you have those diabetes, hypertension, or not hypertension so much, but diabetes, lung disease, and heart disease. And then the fourth one is you're probably going to be in the emergency room. You're sick enough with what we call impending respiratory failure. You're sick enough that you should be in the ER. Well, that person's going to get tested, given what they present with. So you would still, now if you present with those and you call us and present with those, we're going to make arrangements for you to be tested.
Do we have a number on how many people that have been tested in Lubbock?
I don't have that number.
what is the concern with spring break next week for Texas Tech, that all the students are going to go and then come back? Does that act as a net to bring that back to Lubbock?
Sure. No, it's concerned, but we're asking them to self-report as soon as they get back.
And also look at the travel restrictions and the travel areas to avoid before you take that trip.
We're asking for everybody to use common sense. You know, I wouldn't go to these areas that are listed on the map that have big red circles on them. I know you may want to, but perhaps it's not a great idea to do those. You know, one time in your life you're going to miss going to wherever because it has a big red circle on it. Maybe next year, okay? But just use some common sense and not do those sorts of things.
You can access, if you just a second, you can access through the pages that Ms. Wells talked about, and you can click on those links and it will take you to where you are starting to see these clusters. So again, the news today is Harris County and Fort Bend County. That's why the Houston Livestock Show and Rodeo was canceled. That information is out there. Use it, please, before you make your travel plans.
If you can repeat that web address one more time, and is there also a phone number?
Yes. So it's the City of Lubbock's Health Department webpage.
Yeah, and you can go to mylubbock.us, pull up our homepage. On the right-hand side, there is a box. The top line on that talks about the coronavirus. If you click that, it will take you into all of these web pages, and we'll see if maybe we can pull it up for you.
I believe the Texas Tech webpage I believe it links you to the very same thing.
The Chamber of Commerce is tied back to our page and back and forth, so multiple avenues to get to that information, and it's being updated very rapidly.
And then we do have staff at the health department fielding calls, and that's 775-2933 is the main health department number, and there's a group of people answering the questions, and if it's a more difficult question, we have nurses that they can speak with.
And bilingual as well?
We do have some Spanish speaking, and then I also have translation service available.
You mentioned earlier, I know that we keep targeting older adults.
More
but
mature.
More mature. In Dallas, you had the father that exposed his wife and the 3-year-old child that did actually get the coronavirus. How is it that the child that's 3 years old contracted the virus?
They too may not have seen this strain of. There's lots of coronaviruses. We know that already. This child just hasn't seen this one, and so this child got the infection. Now, the odds are in their favor that children do better. We don't know exactly why. There's lots of presumptions out there. I'm not an immunologist. I'm a family medicine doc, and so the kids just typically do better than our more mature population.
With situations like that where it's a family all together, how does that work whenever it comes to self-quarantine? I mean, is it okay for them to still stay in contact with each other? Or
They're
just stay
sick,
all
yeah.
separate?
Yeah, sure. And I don't think a mother or a father of the child wants to be separated from their child. You know, if you have a healthy child, I would say we'd have to just work through that scenario. And Catherine's good at helping us work through those scenarios. But to try to keep the family, if they're all sick, then they need to stay together. That's fine. We're not trying to be that mean.
Are there any upcoming gatherings in Lubbock that y'all are particularly worried about? Any large gatherings?
No, no, not. I mean, everybody's got something going on, right? And so there are some concerns, but I think people are trying to modify those sorts of events to see if they can move it to an outdoor venue. That would probably be better than an indoor like this room. All of y'all. Which one of you? But. And so we can get, air moving better, and people can have closer or further separation from each other. You just have to, I don't know of any big events coming up.
Well,
there may be some.
We'll make fact-based decisions.
Yes.
We're going to use common sense, and we're going to be well informed, and we're going to stick. We're going to use that as our sort of our litmus, and it's about. We don't need to get ahead of things, but we'll make good fact-based decisions.
What about churches?
I know that some.
Are you utilizing any of the 211 services to also help provide information?
311.
Well, how about 211? because it's a popular one.
The 311 system here in the city is set up with the scripts and the links to take people to the information we have.
Doesn't it
I don't
close at a certain time?
close. It opens at 7:30 and closes at 5:30, and I don't have the answer to the 211, but we can look at it.
You mentioned the onset time of 2 to 14 days. Before the infection starts to show up, can you still transfer it?
Potentially you can be infectious. That's the concern. And so, but how do we know? We just don't know. How do you know if somebody's carrying it and somebody's not carrying it? That's the hard part, and that's where we get these community spreads too. So.
Okay. Got time for one more. Anybody?
Does climate affect the?
Everything that I've read, we see a kind of a wane in the flu season as the weather warms. Why that happens, I don't know. Maybe people are more outside instead of clustered up inside enclosed buildings and that sort of thing. Perhaps, but we don't. I wouldn't count on it. We don't need to cross our fingers and turn the other way and hope May 31st or May 30th gets here and everything's gonna be grand. No, I think we still move forward as if maybe. I wouldn't count on it. We can't count on it.
Okay. Thank you to everybody for coming today. We very much appreciate it. Take advantage of the resources that are available. City will continue to try to do this once a week, as well as to issue a report on Friday that shows you what's going on. We're moving towards being able to do that on a daily basis, and that's focused strictly on Lubbock, what we see, what we don't see. So thank you all, and everybody have a great afternoon.